Hi, welcome to my channel. I'm Linda and I have finally made it onto YouTube. Yes. I'm so excited to be here and share with you all things corporate nursing, corporate healthcare, a better lifestyle and everything in between. I'm a corporate nurse. I've been nursing for the last 15 years. Yes, 15 years. Can't believe it myself sometimes. But for the last 7 years, I've been a corporate nurse. Now, you may not have heard this type of nursing before, so please do stay tuned where I'll be discussing what is corporate nursing and specifically the challenges around corporate nursing, especially if you're considering a move from a clinical role into a non-clinical role, and that can include from bedside nursing into corporate nursing. What I do advocate is really do a deep dive and think about opportunities that are out there that you can transfer into within healthcare. Healthcare is a big business. There is so much opportunities out there for you. If you are thinking that actually you want to utilize your skills in another area of healthcare, then I hope that this will shed some light for you. I am also really mindful that there's an upcoming generation that still want to pursue their passion and actually want to get into nursing or even the healthcare profession. So I really don't want to discourage people entering. What I do want to shed some light, other areas in healthcare to consider. Now, I'm not going to lie, it is tough. It's tough by the bedside, it's tough corporately, it's just tough within healthcare. But as there are challenges everywhere, there are also some great opportunities for self-development and continuous learning. Now, on my socials, I do share my day-to-day. Please follow me on my socials and let's get into what is corporate nursing. Now, I'm going to explain my definition of corporate nursing because if you go on to search engines, it's not really a clear-cut definition or a definition that really articulates what corporate nursing is. So here we go. Corporate nurses are employed in a non-clinical role or setting within an organization, working collaboratively with professionals to support and or deliver on clinical or non-clinical activity, products or services. Simply put, it is a non-clinical role. Examples of corporate nurse role include being a project manager, a case manager, patient safety lead, divisional director, and even your chief nurse. Transitioning into corporate nursing brings a whole new challenge, as well as some great opportunities. However, this video will explore 3 significant challenges that nurses may face during this transition. This is not the only challenges, I just want to add. These are just some of the highlights that I think that will be beneficial to share. Challenge number 1. Shifting your mindset from clinical care to non-clinical responsibilities. One of the biggest adjustments when moving towards a role within corporate is actually the shift in priorities. If you're within bedside, your focus is on your direct patient care, whereas within corporate nursing, it potentially involves operational and strategic management across the organization. Each role does vary, but this is an idea to give you some insight. You will find yourself spending no time at the patient's bedside and more time in meetings and within the office environment, which can be challenging for those who really do find fulfillment in hands-on care and really can't think of anything worse than being in the office environment, and that's okay. I had worked 7 years actually in clinical, in a variety of roles, pediatrics, adults, in the UK and internationally in Saudi, but I'll get on to my Saudi experience in another video. And if you want to know more, comment down below. I am actually a pediatric registered nurse. My career has just taken me on a journey where I have seen it all. But I digress. So when I was clinical, my focus was on my pediatric patients as I'm pediatric registered and delivering compassionate care to my patients and families. When I moved into corporate and my focus was on more of a governance perspective, my mindset shifted into thinking strategically and actually prioritizing organizational needs, requirements and deadlines, and actually communicating to the wider teams and stakeholders in regards to key agendas and implementation plans. And you have to remember, all this takes time to adjust. This really did take some time for me to adjust, especially as I was quite a hands-on, directly involved in patient care, and then I just transitioned into corporate. Challenge number 2, navigating the corporate environment. Now, I could talk a lot about this because there is so much to talk about, so much to unpick, from your personal brand, how you dress if you're not in uniform, and the corporate language that is used in the corporate setting. Nurses work closely with internal and external stakeholders such as operations, directors, executives, or even board members. Now, don't be put off by the word stakeholders. It is literally a fancy word for individuals or groups that have an interest in the outcome of an organization. And what I mean by that is, so for example, within healthcare, internal stakeholders are staff, managers, executives, so on and so forth. And external stakeholders can be considered ones that have the close relationships with and have a vetted interest in the organization. And that could be your regulators, such as the Care Quality Commission. You've got regulatory bodies such as Department of Health and the UK Health Security Agency, previously known as Public Health England. Now, for context, I am based in the UK, so this is in relation to the parameters within the UK. So your stakeholders, internal or external, may have a different perspective and priorities to you, and you have to ensure that the message that you are communicating is articulated and understood by the varying groups you have professional relations with. Adapting to the corporate culture can be overwhelming. You really have got to understand at a strategic level the dynamics. If you don't know, you'll find yourself being like, However, I am here to help you navigate it. It's really important to find your voice, and it's crucial to invest the time in learning about the corporate structure, communicating effectively with your colleagues, and understanding the values, mission, and the strategic goals of the organization, which you will see more at a strategic level. Now, there are times where I've had to code switch, yes, to really just adapt to the corporate environment. I'm from South London, so I've really had to adapt in my emails and my phone calls, and you'll find that in some instances, you will adapt to ensure the message you communicate is articulated that makes you sound more confident. For example, changing from saying, I'm not sure if this strategy will work because it's not been well received by anyone, and moving to say, based on my understanding and within the current climate, our focus should be on retention strategies, and we should focus on hotspot areas to drive engagement. It's all about talking the corporate lingo. And if you don't know it, I'm going to tell you. Because in this life, we all need to win. We all need to support. We all need to drive. We've got to stay positive with everything that's happening around us. In some ways, we also have to take the steps to unlearn areas that doesn't allow us to thrive or communicate effectively. Instead of saying, sorry, I'm not sure, you can say, I have a question in regards to Q2's profit and loss report, as it seems that our surgical cases are down, resulting in a significant downfall in revenue. I highlighted profit and loss reports here. This is mostly common within the independent sector, so that's the private sector. And within the public sector, there is more focus on allocated budgets. Challenge number 3, developing business acumen. Now, I don't know about your nursing school, but my nursing school did not teach me about healthcare being a business. And I think if I had understood that concept, it would have really allowed me to understand a lot of decisions that happen within healthcare. You're not really taught about strategy development, operations, or even change management. It was only when I did a master's in health management where I learned all of this. Corporate nursing often requires a broader skill set beyond clinical expertise, and it's really important to hone in your business acumen and your leadership skills, as this all contributes to effective decision-making processes. And actually, these decision-making processes can affect the organization. You'll find that you'll have to learn new concepts such as budgeting, financial analysis, and project management. Additionally, you also may be responsible for leading large teams or overseeing specific projects. And again, this is not necessarily taught within your clinical role, but it is so important when you move over and step into the non-clinical space. I'll give you one of my examples. So in one of my roles, I project managed a CQC registration process. And for those who don't know who CQC are, they are the Care Quality Commission, and they are the independent regulators for health and social care in England. Now, I really had to learn about key deliverables, milestones, Gantt charts, stakeholder relations, project risk, and managing the registration process. I learned all of this within the role as well. Shout out to having a good mentor. It really allowed me to hone in on my project management skills. Overcoming these challenges requires dedication, a willingness to learn, and really actually being adaptable. Here are a few tips to make the transition smoother. If you are still thinking about moving from clinical into a non-clinical role, seek mentorship. This may not always be easy to find, but if you can connect with experienced nurses or nurse leaders who have successfully transitioned to corporate roles, that is also another way to ease yourself in. Because having guidance and insights is invaluable, and it can really help in navigating the challenges you may encounter. Continuous learning, engage in professional development activities, attend workshops, seminars, webinars. There is so much. Put yourself out there and pursue relevant certifications to enhance your knowledge and skills in the corporate nursing realm. One of the things I do to keep abreast of what's happening in the healthcare landscape is actually follow a lot of companies on LinkedIn to see what's the latest information in real time. Network. I cannot tell you how important networking is. Your network is your net worth. I'm sure you've heard this before, but I cannot tell you, it is so true. And I don't think as nurses we're as good as networking as we should be, but we need to be. So many opportunities have opened up to me because I am always networking. You really need to build relationships with colleagues from different departments, even outside your organization. Collaborate on projects and leverage the expertise around you. Remember, establishing strong connections can help you navigate the corporate environment more effectively. Be professionally curious. I am so big on networking, like so big. Actually, recently, I co-hosted a nurses and midwives networking event in central London, which really connected student nurses with registered professionals and actually showcased so much diverse job roles available that I didn't even realize were there. I hope you found this information helpful. Please comment down below if you are considering a transition from bedside nursing to corporate nursing, or if there's anything else that you want me to do. Remember, while there are challenges, there are some great opportunities as well for personal and professional growth within corporate nursing world. Don't forget to like this video, subscribe to my channel, and hit the notification bell to stay updated. Thank you for watching, and I will see you in my next video.